Hello guys, good day. My name is Dr. Kunle, a medical doctor. Today we want to talk about cervical cancer, a disease that affects millions of women around the world. Today's topic is sponsored by May Central Healthcare, and sit back and enjoy. Cervical cancer is the cancer of the cervix. The cervix is termed as the organ that is at the neck of the uterus. Cervical cancer accounts for over 30% of all cancer deaths worldwide. Cervical cancer usually affects women of postmenopausal age. The causes of cervical cancer is largely unknown, but is usually likened to infection by the human papilloma virus. It can also be caused by smoking. It can also be caused by having multiple sexual partners. It can also be caused by having many children, usually above 5. There are really no early signs and symptoms of cervical cancer because in the early days of cervical cancer, it's largely silent. By the time a woman starts having symptoms of cervical cancer, she has probably reached the very bad end of it. First thing is having multiple sexual partners, which can in turn lead to getting an infection from the human papilloma virus. The next one, smoking, is also a risk factor. When a woman has many children above 5, is also a risk factor. These are the commonest risk factors in this part of the world. So regular screening is very important because it helps you catch the cancer at the early stage. Screening such as pap smear and some form of cervical examination are very crucial in checking. Also, getting the vaccine at an early time also helps to make sure that the person can stay free of cervical cancer for life. Well, the age of screening, I say once a woman is of reproductive age and she's already sexually active, she can already start screening for cervical cancer. When she screens, it takes about 5 years for her to get another screening. But then, when it comes to immunization, we always encourage that even pre-pubertal ladies from the age of 9 years should also start getting vaccinated. October was designated as Breast Cancer Awareness Month, and one of the theme was support for people who are living with it. So I say every human being living with every form of cancer should get as much support as they need. Because most especially when cervical cancer, it's not their fault. They were just victims of some circumstances. Most of these women don't even know when or how it came about. So I believe the level of support that they should get should be very, very, very maximum. Cervical cancer can be prevented through vaccination and through screening. One, through vaccination, because by the time you get vaccinated against the human papilloma virus, which is the #1 virus that causes cervical cancer, and you don't get infected after being vaccinated, then you are free for life. For screening enables the woman to get detection early, and then early detection to any illness and to any cancer can make sure the person is properly treated. The signs and symptoms of cervical cancer can include vaginal discharge, which can last for a while, and also we call it postmenopausal bleeding, when there's bleeding after the menstrual period has stopped, and then the woman starts bleeding. That is usually a common telltale sign of cervical cancer. So early detection and screening is very, very important. Because cervical cancer is peculiar to postmenopausal women, it is important to detect early before menopause arises by doing regular vaginal cervical screening. And then when you do that, when the screening is done, the healthcare worker can now determine if there's a tendency of the woman getting the full-blown cervical cancer in future or not. Human papilloma virus, or HPV, is the #1 virus that causes cervical cancer in this part of the world. There are a couple of lifestyle changes that can help to reduce the risk of cervical cancer. Number one is sticking to one sexual partner. Number two, family planning has to reduce the amount of children. Three, also you need to stop smoking, you need to stop drinking fruits, vegetables, and do a lot of exercises. So the word is get screened and get vaccinated. You can get vaccinated at May Central Healthcare. The social media handles will be there on the screen, and then you can also click subscribe, like, and